A lot of people know that increasingly people are using these weight loss drugs, the ones such as Wegovy, Ozempic, and other brands. But obviously they're new, they have a lot of impact on our health, but what impact do they have on their oral health? That's something we're not talking about. So Dr. Kamboh, timely topic. What are you seeing on our end in terms of the impact of these weight loss drugs and an individual's oral health?
Great question, Rob. And you're exactly right. People are using these drugs very often these days. Sometimes they don't tell you, they don't want to admit that they're actually using it, but they are using it, and their mouth will tell a different story. So there are a few main things that I have noticed. One of the bigger things that I've seen is people have a drier mouth, so there's decreased salivary flow. And in general, what saliva does, saliva washes things off of your teeth. So it washes food particles off your teeth so they don't stick on there. It also helps to break down the food, but it also helps as a neutralizing agent for the acids. So when you have a decreased saliva, you have more things are sticking to your teeth. You have less ability to buffer against the acid, and the acid is what helps to produce decay. So you're seeing a lot more incidences of patients getting cavities. Something else that I'm seeing is sometimes these drugs can make you a little bit more nauseous. And so sometimes people are vomiting a little bit with that. So stomach acids coming in the mouth, you're starting to see more acid erosion on the teeth. Also people, like, it's inducing some reflux in some patients. You're also seeing that stomach acid come up when it shouldn't be. But one of the things that really sticks out is a higher incidence of bad breath. People have, it's kind of can be described as like a fishy smell. I know that sounds very pleasant, but it's a fishy odor,
Yeah.
and that is just due to the slower gastric emptying that accompanies these drugs. So that is something that you could see. All those things have come up in the dental office.
So with the lower saliva generation, is there something people can do, or is it something a dental professional treats? Like, I don't know, what can be done?
Great question. Staying really well hydrated. So drinking more water. There are mouth rinses that can help to increase the saliva flow, like biotin, but also coming in more regularly to get checked up. The decay will happen rapidly. These are not the only medications that cause dry mouth. Blood pressure medications there's a lot of different things that can cause dry mouth, but I'm starting to see this. People don't know what effects the GLP-1s are having on the oral health, but
Yeah.
I'm seeing this quite a bit.
So it sounds like good takeaways. One, be honest with your dentist about drugs that you're taking.
We're all proud of your weight loss. It's okay if this
It's
drug
okay.
is
It's okay.
We're fine with that. That's okay.
Yeah.
Not going to
But
judge. No judgment here.
understand that there can be unintended consequences or things that you just laid out. So obviously that's something to have a discussion on and get checked out during your dental appointment. So interesting. Everyone thinks of obviously weight loss drugs in a certain aspect, but it can have impact on oral health. So I'm sure a lot of folks are considering this and hopefully find this very helpful. So appreciate your insight, Dr. Kamboh.
You're welcome. Thanks, Rob.
Take care.